I want to talk today briefly about fibromyalgia. Fibromyalgia is a condition that affects thousands of people in Arizona, tens of thousands of people, hundreds of thousands of people nationally, and globally millions. And there's really no good treatment for it. A lot of times pain doctors such as myself dismiss it as mental condition. There's nothing wrong with you. It doesn't show up on an MRI. There's no blood test for it. This person must have some mental problems. But the reality is fibromyalgia is an actual diagnosis. Basically what happens in fibromyalgia is that some of your neurons that are in your spine, they're called wide dynamic range neurons, instead of being asleep, which is what they should be, they become activated and they're constantly firing off pain signals to the rest of your body. So your brain thinks that your back is hurting, your shoulder's hurting, your foot is hurting, but really all of the pain is being mediated by these sleeper neurons that are sitting in your spine. It's kind of like watching a crime thriller where the bad guy has a burner cell. 1 minute he's in Tokyo, 1 minute he's in Berlin, 1 minute he's in Chicago. Actually, he's just across the street. And that's what's happening in your spinal cord. The treatment for this, now these wide dynamic range neurons have a receptor on them called an NMDA receptor. Ketamine blocks that receptor. I've been doing IV ketamine for fibromyalgia for the past 5 years. I would say about 80% of my patients receive some benefit from it. Now, it also helps with depression, which a lot of fibromyalgia patients have, but that's not the basis for why their fibromyalgia gets better. I've had patients that are basically bedbound that have been able to go back into white-collar jobs and they fly around now. It is something that I think is very, very promising for the fibromyalgia patient. And I think that fibromyalgia patients are being ignored right now in our medical field and they need to have a home. And in my clinic, they will. If you want to learn more, please drop the word doctor in the comment section below.